Picture this, you're sipping coffee in your cozy kitchen, flipping through a magazine, when a strange heaviness settles in your chest. It's not quite pain, but it feels wrong. Your breath catches, and a cold sweat prickles your skin. You're alone. No one's there to help. What do you do if you're over 60? This moment could be a heart attack, and the next few minutes might decide whether you survive. It's a terrifying thought, but here's the truth: you can take control. You don't need to be a doctor or have someone by your side. You just need to know a few simple steps that could save your life. Heart attacks don't always announce themselves with dramatic chest clutching like in the movies. They can sneak up quietly, especially for seniors, and they strike more often than we'd like to think. But here's the good news: even if you're alone, you're not helpless. In this video, I'm going to walk you through 7 life-saving tips every senior must know to survive a heart attack alone. These aren't complicated medical procedures. They're practical, everyday actions you can take right now to be ready. From spotting the first warning signs to making sure help reaches you fast, we'll cover it all step by step. Stay with me until the end, because the final tip is one most people overlook, and it could be the difference between walking out of the hospital and not making it there at all. Let's dive in and empower you to face this fear head on. Tip 1, know the warning signs before it's too late. The first step to surviving a heart attack alone is recognizing it's happening. This sounds simple, but it's where many seniors trip up. You might think a heart attack feels like a lightning bolt to the chest, but for older adults, it's often more like a whisper, a subtle nudge your body gives you before things get serious. If you miss these early signs or brush them off as just aging, you're losing precious time. Every second counts when your heart's crying for help, so let's get clear on what to look for. The classic sign is a pressure or squeezing in the center of your chest. It's not always sharp pain. It might feel like someone's sitting on you, or like your chest is being slowly tightened in a vice. It could last a few minutes, fade, then creep back. But here's where it gets tricky. Heart attacks don't always stay in the chest. You might feel shortness of breath, like you can't catch a full lungful of air, even if you're just sitting on the couch. Some folks get pain or discomfort in their arms, usually the left one, shoulders, neck, jaw, or even their back. Others feel lightheaded, dizzy, or break out in a cold, clammy sweat. Nausea or a sudden wave of fatigue can hit too, especially for women or those over 70. Sometimes it's just a vague sense that something's off, like your body's trying to sound an alarm. Let me tell you about Margaret, a 68-year-old retired teacher from Ohio. One evening, she was watering her garden when she felt a strange ache under her collarbone. It wasn't intense, so she thought it was just from carrying the watering can. But then she got winded, like she'd run a lap, and her hands felt clammy. She remembered a friend mentioning that heart attacks in seniors can feel like indigestion or tiredness. Instead of heading inside to lie down, she sat on her porch and paid attention to her body. That choice to listen saved her life. She called for help before things got worse. Now here's where I think a lot of advice falls short. It doesn't stress how sneaky these symptoms can be. Too often we seniors tell ourselves it's probably nothing, or I'll tough it out. Maybe it's pride, or maybe we're just used to aches and pains. But a heart attack isn't something to shrug off. If you feel that pressure, shortness of breath, or any combo of those warning signs for more than a few minutes, don't second guess yourself. Your body's whispering for a reason, and it's up to you to listen. Unlike the original advice you might have heard, I'm not just going to list symptoms. I'm urging you to trust your instincts. You know your body better than anyone. If something feels wrong, treat it like an emergency, even if it seems small. To make this stick, try this right now. Think of one time you felt off, physically, maybe a weird ache or sudden tiredness. Could it have been a warning sign you ignored? Next time, promise yourself you'll pause and check in. Keep a mental checklist: chest pressure, shortness of breath, arm or jaw, discomfort, sweat, nausea, dizziness. If 2 or more hit at once, act fast. And don't worry about bothering anyone. Paramedics would rather check you out for nothing than arrive too late. This step is about giving yourself permission to take your health seriously. You've earned the right to put yourself first, so do it. Tip 2, call 911 without hesitation. The moment you suspect a heart attack, your very next move is to pick up the phone and call 911. No waiting, no debating, no hoping it'll pass. This step is your lifeline, and it's the one thing that can make the difference between getting help in time and facing a tragedy. When you're over 60 and alone, every minute your heart goes without enough oxygen causes more damage. Calling 911 isn't just about getting an ambulance. It's about starting a chain of care that gives you the best shot at survival. Let's break down why this is so critical and how to do it right. First, understand what happens when you dial 911. You're not just summoning a ride to the hospital, you're connecting with trained professionals who are already gearing up to save you. Dispatchers can guide you through what to do while help is on the way, and paramedics are bringing life-saving tools like defibrillators and medications. They're ready to act the second they reach you, which is something you can't get if you try to handle it alone. A lot of folks think I'll drive myself or I'll call my neighbor first. That's a mistake. Driving during a heart attack is dangerous. You could pass out, crash, or delay care. And calling family or friends while tempting wastes time they might not be equipped to handle. 911 is the fastest, surest way to get help, period. Take the story of Henry, a 72-year-old widower from Texas. One morning he felt a dull ache in his chest and a wave of nausea while reading the paper. His first instinct was to call his daughter, but he remembered a community talk about heart attacks that stressed calling 911 immediately. He grabbed his phone, dialed, and told the dispatcher his symptoms. By the time the ambulance arrived, his pain had worsened, but the paramedics stabilized him on the spot. Later, his doctor told him that calling right away shaved critical minutes off the damage to his heart. Henry's story shows that acting fast isn't just smart, it's a game changer. Now let's address a weakness in some heart attack advice. It often glosses over the emotional barriers seniors face when calling for help. Maybe you're worried about making a fuss or feel embarrassed if it turns out to be nothing. I get it. Nobody wants to feel like they're overreacting. But here's the truth. Paramedics and dispatchers want you to call even if you're not 100% sure. They'd rather check you out and send you home with a clean bill of health than arrive too late. Your job isn't to diagnose yourself, it's to give the experts a chance to do their job. Another overlooked point is preparation. If you live alone, keep your phone within reach, especially at night. Know where your emergency call button is. Most smartphones have a shortcut even when locked. Practice finding it so it's second nature. Here's a practical tip to make this easier: program 911 into your speed dial or keep a cordless phone by your favorite chair. If you're feeling symptoms and can't speak clearly, stay on the line anyway. Dispatchers are trained to listen for clues like your breathing or background sounds to send help. And if you're worried about privacy, don't be 911 calls are confidential, and the focus is on getting you help, not judging you. Unlike some advice that stops at call for help, I want to emphasize mindset. Tell yourself right now, if I feel off, I'm calling 911 first. It's not about being dramatic, it's about giving yourself the gift of time. One more thing to boost engagement. Think about someone you love, a spouse, a child, a grandchild. If they were having these symptoms, wouldn't you want them to call 911 right away? You deserve that same care. Make this a promise to yourself and to them. If you're finding this tip helpful, drop a 2 in the comments to let me know you're with me. It's a small way to connect, and it helps me keep bringing you content that matters. Tip 3, chew an aspirin to buy precious time. Once you've called 911, your next move is simple but powerful. Grab an aspirin and chew it. Yes, chew it. Don't just swallow it whole. This small act can be a game changer when you're alone and a heart attack is starting. If you're over 60, keeping your heart going until help arrives is all about buying time. An aspirin is like a secret weapon you probably already have in your home. Let's dive into why this works, how to do it right, and why it's so much more than just popping a pill. Aspirin thins your blood, which helps stop a blood clot from growing in the artery that's causing the heart attack. That clot is like a dam blocking the flow of oxygen to your heart muscle, and every minute it stays there, more damage happens. Chewing a standard 325 milligram aspirin gets it into your bloodstream faster than swallowing it, sometimes in just a few minutes. Studies show this can slow the clot's growth, ease the strain on your heart, and even restore a bit of blood flow until paramedics arrive. It's not a cure, but it's a bridge to keep you alive. Now, a quick note: if you're allergic to aspirin or on certain blood thinners, check with your doctor ahead of time to know if this step is safe for you. For most folks, though, it's a lifesaver. Let's talk about Dorothy, a 66-year-old from Florida. She was alone in her apartment one night when she felt a heavy pressure in her chest and a tingle in her arm. After calling 911, she remembered a health talk at her senior center about aspirin. She shuffled to her bathroom, found a bottle of regular aspirin in the cabinet, and chewed one slowly, even though her hands were shaky. When the paramedics arrived, they told her that aspirin likely kept her heart from taking on more damage. Dorothy later said, "I never thought a little pill could do so much, but it felt like I was fighting back." Some advice out there stops at taking aspirin, but that's not enough. First, you need to know where your aspirin is. If you live alone, store it somewhere easy to reach your nightstand kitchen drawer, or even a small bottle in your purse or wallet. Check the expiration date every year. Old aspirin might not work as well. Second, don't use coated or delayed release aspirin if you have regular ones available, because they take longer to kick in. If coated is all you've got, chew it anyway. And here's a tip most guides skip: try to stay calm while chewing. I know that's tough when you're scared, but taking slow, steady bites helps you focus and keeps your heart rate from spiking. Another gap in typical advice is addressing the what ifs. What if you're not sure it's a heart attack? Chew the aspirin anyway. If you've called 911 and it's safe for you, it won't hurt if it's not a heart attack, but it could save you if it is. What if you're on an empty stomach? In this moment, the risk of a stomachache is far outweighed by the risk of waiting, and don't chase it with a big glass of water. A small sip is enough to help it dissolve. To make this second nature, consider keeping a sticky note on your aspirin bottle that says "chew for heart attacks" so you don't freeze up in a panic. Here's a way to connect this to your life. Think about your daily routine. Where do you spend most of your time? Keep Aspire in there. If you're loving this tip, drop a 3 in the comments to let me know you're following along. It's a little way to show you're part of this journey, and it keeps me motivated to share more. Tip 4, stop moving and rest to protect your heart. Once you've called 911 and chewed an aspirin, your next job is to do something that might feel counterintuitive. Stop moving and rest. When a heart attack hits, your heart is fighting to get enough oxygen, and every step, lift, or reach you make adds strain it can't afford. If you're over 60 and alone, this step is about giving your body a fighting chance to hold steady until help arrives. It's not about giving up, it's about being smart and saving your strength for survival. Let's talk about why resting is so critical and how to do it the right way. Your heart is like an engine running low on fuel during a heart attack. Any extra effort, pacing, cleaning up, or even walking to the door, burns through oxygen your heart desperately needs. By sitting or lying down, you lower your heart's workload, slow your breathing, and help your body stay calm. This isn't just about feeling better. It's about preventing your heart from tipping into a worse rhythm or stopping altogether. Studies show that staying still can reduce the risk of complications in those crucial first minutes, giving paramedics a better shot at saving you. Consider Evelyn, a 75-year-old from Colorado. She was folding laundry one afternoon when she felt a tight squeeze in her chest and got dizzy. Her instinct was to keep moving, maybe tidy up or grab a glass of water to shake it off. But she recalled a doctor's advice from a checkup. If your heart's in trouble, sit down and stay put. She sank into her armchair, propped her back against a cushion, and focused on breathing slowly. When the paramedics arrived, they said her calmness likely kept her heart from going into a dangerous rhythm. Evelyn later told her friends, "I felt silly just sitting there, but it was the best thing I could have done." A lot of heart attack advice mentions resting, but doesn't dig into the emotional side or practical details, which can leave seniors unsure. You might feel restless or think, "I need to unlock the door," or "I should look presentable." Let go of those urges. Your only job is to survive, and that means keeping your heart as unburdened as possible. If you're standing when symptoms hit, move as little as you can to a safe spot, a chair, couch, or bed. Sit with your back-supported feet flat on the floor and arms relaxed. If you feel faint or woozy, lie down on your side with your head slightly raised, maybe on a pillow. This helps blood flow without taxing your heart. Here's a practical tip: pick your resting spot now. Where do you spend most of your time at home? Make sure there's a comfy chair or couch nearby. If you're prone to dizziness, keep a small pillow handy to prop your head. And don't worry about looking weak by resting. There's strength in knowing when to pause. Another gap in typical advice is addressing the mental battle. It's natural to want to power through or feel embarrassed about doing nothing. But resting is active survival. Think of it like pulling over when your car's engine light comes on. You're not quitting. You're protecting what matters. To make this real, picture a moment you push through discomfort instead of resting. Maybe you kept working through a bad day or ignored a warning sign. Now imagine choosing rest instead. Practice it today. Sit down, take a few slow breaths, and notice how it feels to let your body relax. If you're finding this tip helpful, drop a 4 in the comments to let me know you're still with me. Your feedback keeps this conversation going, and I'm here for you. Tip 5, unlock your door to speed up. Help after you've called 911, chewed an aspirin, and settled into a resting position. There's one small but mighty step you can take if you're able. Unlock your front door. It might seem like a minor detail when you're over 60 and grappling with a possible heart attack, but this simple act can shave precious seconds off the time it takes paramedics to reach you. When you're alone, every moment counts, and an unlocked door means help gets to you faster. Let's explore why this matters and how to make it work without putting yourself at risk. When paramedics arrive, their goal is to start treatment immediately, whether it's giving you oxygen, checking your heart rhythm, or rushing you to the hospital. A locked door forces them to break in, which takes time, creates noise, and could even startle you if you're nearby. In a heart attack, seconds can mean the difference between minimal heart damage and a life-threatening crisis. By unlocking your door, you're rolling out the welcome mat for the people coming to save you. It's like clearing the runway for a plane to land smoothly. Plus, it reduces the chance of property damage or injury, letting the focus stay on your care. Let's look at George, a 70-year-old from Michigan. One quiet evening, he felt a heavy pressure in his chest and shortness of breath while watching TV. After calling 911 and chewing an aspirin, he remembered a tip from a first aid class: unlock the door if you can. He was just a few steps from his front door, so he carefully shuffled over, turned the lock, and sat back down in his recliner. When the paramedics arrived, they walked right in and started working on him instantly. George later learned that those extra seconds helped them stabilize his condition before his symptoms worsened. "I almost didn't bother," he said, "but it was like handing them a head start." Some heart attack advice mentions this step, but doesn't address the practical or emotional hurdles seniors face. You might think, "I'm too weak to walk," or "what if I fall trying?" Here's the deal: only unlock the door if you're close by and feel steady enough to do it safely. If you're across the house or feeling dizzy, stay put. Your safety comes first, and paramedics can handle a locked door. Another gap is planning ahead. If you live alone, think about your home's layout. Is your front door easy to reach? Do you have a deadbolt that's tricky to turn? Consider installing a smart lock you can open with your phone, or a key box outside for emergency access. These small changes can make a big difference. Here's a tip to make this easier. Keep a spare key with a trusted neighbor or in a secure lockbox, and let your local fire department know where it is if you're at high risk. Also, make sure your house number is visible from the street. Big, clear numbers help paramedics find you fast. And don't worry about leaving the door unlocked for a few minutes. The risk is minimal compared to the benefit of quick access. This step is about teamwork. You're doing your part to make the paramedics' job easier, which boosts your odds of survival. To bring this home, picture your front door right now. How far is it from where you usually sit? Could you reach it in a few steps, or is it a trek? Take a moment today to check your setup and make it as emergency-friendly as possible. If this tip's resonating with you, drop a 5 in the comments to let me know you're still here. Your support keeps me fired up to share these life-saving ideas. Tip 6, use your phone's emergency features as a lifeline. When you're over 60 and facing a heart attack alone, your phone isn't just a way to call 911. It's a lifeline that can keep you connected to help, even if things take a turn for the worse. After you've dialed emergency services, rested, and taken steps like chewing an aspirin, using your phone's emergency features can make a huge difference. From hands-free calling to sharing critical health info, your smartphone has tools that can speak for you when you can't. Let's dive into how to use these features to boost your chances of survival and why they're a must-know for every senior. The first thing to do after calling 911 is switch your phone to speaker mode. Holding a phone to your ear takes effort, tires you out, and makes it harder to breathe when you're already struggling. Speaker mode lets you talk hands-free so you can focus on staying calm and resting. It also helps the dispatcher hear you clearly, picking up on changes in your voice or breathing that could signal worsening symptoms. If you're too weak to keep talking, they can still listen for clues and keep help on track. Beyond that, your phone has a hidden gem, the emergency medical ID feature. On iPhones, it's accessible from the lock screen. Androids have similar options. This lets you store vital info like your age, medications, allergies, and emergency contacts. If you pass out before paramedics arrive, They can use this to make faster, safer decisions about your care. Take the story of Clara, a 69-year-old from Arizona. One night she felt a squeezing in her chest and dizziness while knitting in her living room. She called 911, put the phone on speaker, and set it on the coffee table. As her symptoms worsened, she struggled to speak, but the dispatcher stayed on the line, hearing her shallow breaths. Clara had set up her phone's medical ID months earlier, listing her heart condition and blood thinner medication. When paramedics arrived and she was barely conscious, they checked her phone and knew exactly what to avoid in treatment. That info saved critical minutes and kept her stable. Clara later said, "I didn't realize my phone could do all that, but it was like having a friend with me." A lot of heart attack advice skips over these tech tools or assumes seniors aren't tech savvy, which is a big miss. You don't need to be a gadget expert. Setting up your medical ID takes 5 minutes and lasts forever. Go to your phone's health app, enter your birth date conditions like diabetes or high blood pressure, any meds, and a contact like a child or neighbor. If you're not sure how, ask a grandkid or friend to help. It's a fun way to connect. Another gap is explaining why speaker mode matters emotionally. Hearing the dispatcher's calm voice can feel like a lifeline, easing the panic of being alone. It's not just practical, it's comforting. Here's a tip to make this stick: check your phone today. Find the emergency call shortcut and practice switching to speaker mode. Then set up or update your medical ID. Think of it as a gift to yourself, like keeping a spare key. If this tip's hitting home, drop a 6 in the comments to let me know you're still with me. Your comments keep this journey going, and I'm grateful for you. Tip 7, slow your breathing to stay in control. You've called 911, chewed an aspirin, rested, unlocked your door, and used your phone's emergency features. Now, as you wait for help, there's one final tool you can use to keep your heart steady: your breath. When a heart attack hits and you're over 60, panic can make everything worse. Your heart races, your chest tightens, and fear takes over. Slowing your breathing isn't about fixing the heart attack. It's about calming your body just enough to hold on until paramedics arrive. This step is like an anchor in a storm, and it's something you can do right where you are. Let's explore how to use your breath to stay in control and why it's a game changer. When you're scared, your body pumps adrenaline, speeding up your heart and burning through oxygen your heart needs. Controlled breathing tells your nervous system to ease up, slowing your heart rate and helping you avoid dangerous rhythms that stress can trigger. It's not fancy, just a simple pattern you can follow. Try this: breathe in through your nose for 4 seconds, hold it for a moment, then exhale through your mouth for 6 seconds like you're blowing out a candle gently. Repeat it, focusing on the rhythm. It's not about deep breaths, it's about slow, steady ones that keep you grounded. This can lower your blood pressure slightly and make those terrifying minutes feel less overwhelming. Let's talk about Walter, an 80-year-old from Oregon. One morning, he felt a heavy pressure in his chest and shortness of breath while reading in his study. After calling 911 and resting, panic started creeping in his hands, shook, and his thoughts raced. But Walter had learned a breathing trick from a yoga class years ago. He closed his eyes, sat back in his chair, and counted his breaths, 4 seconds and 6 seconds out. It didn't stop the pain, but it kept him from spiraling. When paramedics arrived, they noted his heart rate was elevated but stable, likely because he stayed calm. "It felt like I was holding the reins," Walter said later, "like I had some say in what happened." Some heart attack advice mentions staying calm, but doesn't teach how leaving seniors feeling helpless. Breathing is a skill you can practice anytime, watching TV, sitting in your garden, or before bed. The more you do it, the easier it is to tap into during a crisis. Another gap is addressing the fear of being alone. Those minutes waiting for help can feel like forever, but focusing on your breath gives you something to do, turning panic into purpose. Unlike vague tips to relax, this gives you a clear action that's always with you, no tools required. Here's a practical tip: try the 4-6 breathing pattern right now. Sit comfortably, inhale for 4, exhale for 6, and do it 3 times. Notice how your body feels a bit lighter. That's your nervous system settling. Keep practicing so it's second nature. And if you're worried about losing focus during a heart attack, just count in your head. It's like a lifeline you can't misplace. If this tip's resonating, drop a 7 in the comments to let me know you're with me. Your support means the world. At the end of the day, surviving a heart attack alone isn't about luck. It's about preparation and trust in yourself. These 7 steps: spotting warning signs, calling 911, chewing aspirin, resting, unlocking your door, Using your phone's features and slowing your breath are your toolkit to face the scariest moments with courage. The big lesson, you're never as powerless as you feel. Every small action you take says, I'm fighting for my life. Trust your body's signals, act fast, and lean on these steps to carry you through. You've got the strength to do this, and you deserve every chance to keep living your story. What hit home for you today? Maybe it was one step you hadn't thought about, or a story that felt like it could be yours. Share it in the comments. I read everyone, and your thoughts inspire me to keep going. If you found this video helpful, give it a thumbs up, hit that subscribe button, and tap the bell so you don't miss more life-saving tips. Share this with someone you love. It might just save their life one day. Thanks for being here, and I'll see you in the next video.